Good afternoon everybody. This is Dr. Ajay Randive, consultant knee replacement surgeon from Dr. Randive Super Speciality Clinic, Andheri and Mumbai. Today we'll discuss in short about what are the complications of knee replacement surgery. Whenever any patient thinks about knee replacement surgery, he always thinks about what are the possible complications of this surgery. As knee replacement is one of the major surgeries and a common surgery, we should all know what are the known and unknown complications of this surgery. Now, knee replacement surgery, in which the joint is changed or resurfaced, has got some complications which can occur early during the surgery, within 10 days of the surgery, or late complications which can happen after 3 months or 6 months or even later. In the early complications, within 24 to 48 hours, blood collection inside the joint leading to swelling of the joint is a very common complication. This leads to increasing pain in the joint, but this complication can be treated by aspiration of the blood, clearing of the joint and compression bandaging. Another complication which can occur in early stages of knee replacement are any injury to the nerves which can lead to paralysis of the lower limb or the part of the leg in that area. But again, this is a very rare complication, as during the surgery all care is taken to avoid any injury to the nerve. Another complication which is a bit common but nowadays reduced due to laminar airflow is infection. Early infection used to be a very common complication in early days of knee replacement, but since the invent of laminar airflow, early infection is not very common. But still it can happen in a patient who is immunocompromised, like diabetes mellitus patient or any other autoimmune disease patient where immunity is low. In early infection, patient can have fever after 24 to 48 hours. He can have increasing pain and swelling in the knee joint, tenderness around the knee joint, redness around the knee joint, and difficulty to walk. In this case, we do blood tests of the patient, see the markers of infection such as ESR, CRP and blood counts, and do a washout of knee joint and give appropriate antibiotic. Most of the patients respond to this treatment and patients settle down. In those patients who don't respond, we can do further procedures such as instillation of antibiotic beads inside the joint. In late complications, one of the most common complications is continuing pain and loosening of the joint. This can occur anytime after 3 months or 6 months of the surgery. This is most commonly due to infection which is happened during the surgery or after the surgery, and another complication is aseptic loosening. Generally, aseptic loosening occurs late in the life, that is after 5 years or after 10 years. In aseptic loosening or in septic loosening, the most common symptom is pain and difficulty in walking. In these complications, patient needs revision knee replacement surgery. So these are the most common complications of knee replacement surgery. But even if there are few complications which are associated with this surgery, they can be addressed properly and treated even if they occur. The occurrence is less than 1%, that is 1 in 100 in current situation. And infection is almost rare due to invent of laminar airflow and ventilation systems which lead to less infection. Thank you.